Wyoming is the smallest population state in the U.S., home to approximately 580,000 people. These wide-open spaces are the bedrock of long-standing ranching communities, particularly in Converse County, where generations of Wyoming families still make their living off the land. It's hard, honorable work in one of the most beautiful places in the country. While the quality of life is high, so too is the disproportionate occurrence of major health events like heart attacks, strokes, and diabetes. It's a complex issue that plagues idyllic areas of the country like this one.
We're in a rural space. In fact, we're so rural they call it frontier. And a lot of frontier places in the United States, you don't really have any health care. There's not enough people to support hospitals. There's not enough infrastructure to really have what you need. And so what happens is hospitals shrink or disappear, actually. And you're seeing that all across the country. Small hospitals are basically folding up parts of their services. Our mission has been kind of the opposite. We've decided that we're going to sort of flip the table on that, and we're going to expand healthcare to address the needs that we have in these rural places. You have to have the right infrastructure to be able to support that, and that's what we're focusing on.
A lot of the admissions I see are potentially preventable issues. We know that chronic medical conditions often start with a silent, smoldering phase. By establishing with a primary care provider and undergoing simple, cost-effective outpatient screenings like blood pressure checks, routine lab work, we often can diagnose and treat these conditions before it becomes too late by simple things such as lifestyle interventions or even medications if that's what your provider recommends.
Ashley Ulrich is an internal medicine physician at Memorial Hospital of Converse County. And while she wishes she saw fewer cases like this, the reality is the hospital has made an incredible impact on health outcomes in recent years. And their network of care is growing. At a time when so many rural hospitals are closing their doors, it raises the question, what are the administrators here doing to see such success?
At all fronts, we were improving every function that we have in the hospital, and that's why we've been successful. Over the last 26 years, we've invested over $60 million in this hospital. We had great support from this community. Here you have a county of 14,000 people, and we've raised about $5 million from this county. They support the hospital. And now, today, 50% of our patients come from outside Converse County. We've established clinics in surrounding communities. We purchased a surgical hospital in Casper, and we now are able to share overheads, bring the best doctors there, the best doctors here, and make this work.
Folks who live in rural parts of the country deserve access to the same care as those in urban settings. Given the positive outcomes in Converse County, Wyoming, it's safe to say that with the right care model, it is possible to effect change in areas off the beaten path.
You have to diversify from a service standpoint. Today we have a 320 slice CT, which is state-of-the-art. We have one of the best MRIs in the state of Wyoming. We have the latest ultrasound equipment. We had to diversify the medical services that we were offering. And that's what attracts patients, quality plus a variety of services. If you don't have it, they're going to leave home, they're going to go to an urban center where they do have it.
My wife's grandfather came here about 1904, him and his two brothers, and they settled in this country and started homesteading, and their sisters did too, and we still have the same land that they started with. I have a wife that goes to the physical therapy twice a week, and it's probably as good as there is in the country. You know, now she can go in there, and she's in there for a couple hours, and we're 15 minutes from town. If she couldn't go here in Douglas, probably wouldn't do it. And her health would probably deteriorate too, I'm sure it would.
So the University of Wyoming just recently did a study on the total economic impact of the healthcare system in each county. And we are a tiny county. We have just 2.5% of the population. We're the 13th largest of the 23 counties. But in this study, we came out as the 4th largest economic impact. And that's because we've kept our heads down and we've been building healthcare services. So if you look across the United States or even Wyoming, you look at counties our size, You will simply not find a hospital with this magnitude of services. We are putting together a complement of services that you would expect to see in areas much, much larger than Converse County.
I believe the most important message today is that advances in medicine can help people to live longer, healthier lives, but we all have an individual responsibility to play an active role in our own health and wellness. Establishing with a primary care provider and focusing on preventative screenings and treatments can add years to our life and extend our cardiovascular health. It's important not just for you, but for those who are counting on you as well.
Memorial Hospital of Converse County, cutting-edge medicine with hometown care. To learn more, visit us online or call the number on your screen.